Hi everyone! In this presentation, I want to introduce the initial stages of our efforts to implement a standardized reporting system for Appendix ultrasound at our institution. The problem we identified was that we saw how the language of reports varied greatly between radiologists for appendix ultrasounds. In particular, we were concerned that some phrases were not explicitly or implicitly associated with a clear clinical recommendation for the referring clinicians. Because no guidelines have been widely adopted for appendix ultrasound reports, we set out to develop one tailored for our institution. Our initial step was to really hone in on the problem and establish what kind of variability currently exists, if any. We did this by using qualitative methods to understand current report phrasing. We first used a preliminary set of reports to create a descriptive framework, and then we applied this framework to 200 appendix ultrasound reports. What we found was that the report phrasing could be categorized into two main groups: definitive phrasing, defined as phrasing that is clear and without alternative clinical implication, and non-definitive phrasing, phrasing which is unclear and lacking clinical specificity. It is this second group of non-definitive phrases we're really interested in addressing with our QI project. We saw that within our group of 5 radiologists, these phrases were used very inconsistently. For example, some radiologists never described image quality, while others almost always did. Some examples of other phrases in their variability are listed here. So overall, this poster summarizes our first step in using evidence-based methods to identify inconsistencies in report phrasing. This is a really important foundation for developing a standardized reporting system that meets the needs of a specific institution. Our next steps will be to use these phrases we've identified to survey the clinicians and radiologists involved in the care of these patients. These results will show us how people interpret specific phrases, and we can then establish a standardized reporting system that is more seamlessly adopted by our radiologists and clinicians. Thank you.